Short stature, when someone has less than 3 standard height, all minus 2 standard deviation for age and your gender or sex. Incidence is 2% in the developing nations. In developing nations, it is higher, 20% or so growth failure in BD now, and then in the USA it is 2% or so. Growth failure less than third centile minus two standard deviation can be due to familial or constitutional. More common in the boys. This child has transient hypothalamic pituitary axis hypoactivity. So thereby they have less growth for a couple of years. Afterward, they grow out. So it is to be taken from the history of the parents by, and also mid-parental height assessment will give you an idea about it. If they know the previous history, that's more important. Along with it, the chronic disorders like their bowel disease like IBD, your chronic CNS disease, chronic renal disease, and others. They are the hindrance of enough calorie intake, and hence you have short stature. But more common is the ignorance with the food. Ignorance what to take, what to eat, what not to eat. Appropriate amount of food eating in the growing age. 18 years in the girls and 21 years in the boys is essential. So someone will grow taller before epiphysis is closer. When some epiphysis is closed, someone will not be tall anymore, will not grow in linearly anymore. So other diseases like mucopolysaccharidosis, your genetic disease, of course, your Turner, Marfan, they have their own unique features. Investigation basically minimum. It depends upon the clinical scenario. Someone has your genetic disease genotype, and someone has the chronic infective disease. Yeah, they have respective data. Treatment is dietary and treatment of the counseling, and the dietitian consultation may be good, and then your treatment of the underlying disorders.